We're going to do a basic kinesiotape for the knee just for support and kind of unloading of the kneecap. You get a lot of, in runners, male or female, you get a lot of running pain on this inside of this knee called patellofemoral pain. So basically the inside, either the fat pad or the inside of the kneecap actually kind of just get irritated and rub the wrong way. So what we like to do is we apply this tape to kind of release that pressure and kind of apply a little pressure down here, but release the kneecap to kind of help take some of the pain away. So first thing you want to do with any kinesiotape, you want to make sure the skin is clean, free of any dirt or sweat or any lotions, sunscreen, anything like that. So ideally you would just wipe them off with a little bit of alcohol. To make the tape stick a little better, you would spray with some tough skin, but right now we're just going to, for taping purposes and this video, we won't do that. First one this is the basic knee support, or at least patellar support tape. You have them unloaded just like this in a straight leg position. You have them relaxed, don't have them tighten their quads, and you want to be able to move their patella around. That's how loose you don't want them tight up here. The first one is a small strip, and each of these strips, you look, there's squares, about 2-inch squares on the back. And the square I'm going to put over the kneecap is about 2.5 squares. So from the lateral side of the knee, because we always want to pull everything lateral to medial, because our most dangerous position is going laterally with that kneecap. We glide the kneecap medially, with a little bit of tension, laying down these edges real flat, real smooth. And you can see right here there's a little bit of stretch, and here it's tighter and there's no stretch. That allows the anchors to stay on a little bit better. Now that we've got that patella mob on, we're going to slide her out. Just going to bend her knee back and get in this nice kind of knee bend position. If you can really get them back as far as you want, but for this table, 90 degrees is fine. Again, I'm ripping the tape, or ripping the paper backing, leaving about a 1 block section, not touching the tape, taking care not to touch the tape. What I'm going to do is put it just below the knee, right over the patellar tendon, lay it down nice and flat. And while I come up across the knee, I put a decent amount of pressure, about 75% stretch, and make this little half moon shape. Again, you can just tear it like that, making sure not to touch the tape. It's going to go the opposite direction now. Going to wrap up, about the same thing, 75% stretch, and lay down the last bit flat. Now that I have the tape on, I'm going to just kind of rub the whole thing with the backing of the paper that causes a little friction, because friction activates the adhesive. And so when she straightens her leg out, you'll see a little bit of some folds here, and that's actually the skin being lifted up, a little bit of that pressure being released around the knee, and this is a good one to do for any sort of just general knee pain. It is not super supportive, so it is not, if you have an ACL sprain or you have an MCL sprain, this is not something you want to do. This is for more mild overuse injuries of the knee.